Nicola, I'm one of the care of the elderly registrars.
And I'm Nora, one of the senior physician associates in urgent care.
So our quality improvement project was on improving the recognition and prescribing of time-critical medications. So I think with all of our quality improvement projects, it stems from a problem that we've identified. And the problem that we found, I'm a geriatrician, lots of the patients that I see have multiple comorbidities, they come in on lots of different medications. And whilst lots of medications aren't time critical, there are a huge number that are time critical, and I'll come on later to explain some of the sort of information regarding time critical medications. In certain patient groups, if they have delays in their medications, it can have significant adverse outcomes on their hospital stay. It can increase their length of stay, particularly when we think about Parkinson's patients who might not be able to engage in physiotherapy if they've not had their medication on time. And obviously that leads to increased bed days and increased cost for the trust. It also impacts adversely on patients' outcomes just from their own personal experience. You can imagine if you go into hospital and you don't get the medication that you know that you need, you're not going to be very happy about it. So how big is the problem? And this is data from the national learning system from 2005 to 2006, and they collected data of about 73,000 medication-related incidents. 17% of those relate to omitted medicines or ingredients. So that's a significant number of patient-related incidents because of omitted medications. When we think about, well, how big is that problem, what's the impact of that? So this is a national patient safety alert from 2010, looking at medication errors between 2006 and 2009. There were 21,300 incidents reported. 68 of those related to or caused harm to a patient, significant harm, and there were 27 deaths as a direct result of omitted medications. So going back to our project, we were thinking, well, why don't patients get their medication on time? So we thought about the journey of how a patient goes from coming into hospital to when they actually get that medication. So the first step is that the medication needs to be prescribed. It needs to be available in the right dose and the right form for the patient to take it. The nurse who administers the medication needs to be aware that that medication is prescribed and needs to be given, and then the patient needs to be able to take that medication. They have to be able to swallow it or have it in whatever other form. So we thought, well, let's start at the very beginning. Let's look at the issue of these medications actually being prescribed and why they're not being prescribed. Some people might have come across the Parkinsons UK Get It On Time campaign. We're not reinventing the wheel. People are aware of how important it is that patients get their medication on time, but we thought we don't want to just focus on Parkinson's patients. There are lots of other patient groups, and I'll come on to discuss the certain groups of medications. So we found in our trust 172 time-critical medications, and this is a list that we've got from our pharmacy colleagues who have been on board with us with this project. It sounds like a lot of medications. We can break it down into 9 groups, and they include anticoagulants, anti-diabetic medications, anti-Parkinson's medications, immunosuppressants, steroids, antimicrobials and anticoagulants. So they're all pretty common medications that we need to be aware of.
Alright, so this is our smart aim, for those of you. So it's at the moment we've got it as to increase the prescription rate of time critical medications both in A&E as well as in the assessment areas by 50%, and we're hoping to do that by June 2018, and increase by 50% compared to the baseline from February this month. So why are we choosing by June 2018? Well, I'm sure you're all aware we've got the assessment, we've got the new building currently as we speak, and it's going to be the assessment hub as well. So that's why we'd like to try and make some changes before we move into the assessment hub. Okay, So how are we going to achieve our aim? So our main aim is also to educate both medical and nursing staff about the recognising time-critical medications, and also to realise the impact that delays in prescription as well as the administration of these such medications can have on both patient experience, their conditions already, as well as their length of stay in hospital. So hopefully you can see this. So these are all the things that we'll be measuring. So the outcome measure is to increase the prescription rate of time-critical medications for patients following their decision to admit. So that would be in ED as well as in the assessment areas. We've got quite a few process measures there, quite a few balancing measures that we've come up with as well, and some financial savings. So this is how far we've got in our journey so far. So I agree, we've still got quite a way to go at the moment, but so far we've managed to meet with the A&E consultant who will be supervising us, and also with the leads from pharmacy regarding the list of time-critical medications. We've managed to define the time-critical medications as well that we'll be using, and we've managed to design our collection tool for data. So, as I said, we've still got quite a way to go, so the next step that we're going to be doing will be collecting data. So that'll be our baseline data regarding delays in time-critical medications and omitted doses of time-critical medications. We'll then be surveying, doing a baseline survey of all medical and nursing staff involved in these areas regarding their recognition of time-critical medications and assessing their baseline knowledge. We'll then be trying to educate them in these areas, so holding various education events to try and teach them regarding these time-critical medications and improving their knowledge on these areas. And then we'll be recollecting some data again and comparing it to the baseline data regarding emission of time-critical medication dosages. And then we'll be assessing their knowledge overall again to see if there's an improvement, and fingers crossed there should be an improvement. So as with every project, there's always hurdles that you can come across, and no exception with ours as well. So we thought it'd be quite, hopefully, plain sailing. We thought that we wouldn't come across any hurdles, but we have already. So initially the main hurdle we came across was trying to establish the list of time-critical medications. That took a lot longer than we anticipated. We had to be very involved with our various pharmacy colleagues to try and get a list of time-critical medications. It did take several months, hence why we haven't yet managed to get to the data collection stage yet. Also, all of the team members work in different areas of the hospital, so therefore we don't get much time to actually discuss things amongst each other. So we try and use it wherever we can. And also working mainly in urgent care, so two of us work within the urgent care department. Nicola also comes and does quite a bit of work in the urgent care department. So therefore we're in the busiest area of the hospital. And with winter pressures as well, it's been quite difficult to kind of move the project along as quickly as we'd like to. However, we have made progress, and we're continuing to make progress. So we've got the list of the time-critical medications now. We've got our data collection tool, so hopefully we can start collecting some baseline data soon. No doubt we'll probably come across some more hurdles, but we'll deal with them as we come across them. Okay, and that's our presentation.